My Health Matters is a flagship initiative of Global Health and Community Services, Inc. This monthly one-hour forum aims to educate and inspire communities across the globe. My Health Matters provides culturally relevant health information, resources, and tools to get the best quality health care, access to some of the top health experts. Each episode will highlight the healthcare issues that disproportionately affect many communities, while also providing action steps to help us heal. My Health Matters.
Good afternoon. I am Kitty London, your host of My Health Matters television program. Today's program is being recorded. This television program is brought to you by Global Health and Community Service Incorporated and the Florida statewide organization of Omega Psi Phi Fraternity Incorporated. Our platinum sponsor is the Quantum Foundation of West Palm Beach, Florida. We would also like to recognize our other sponsors, the TED Center, Healthier Boynton Beach, Truist, Nonprofits First, Epsilon Gamma Omega, chapter of Alpha Kappa Alpha Sorority Inc. of Huntsville, Alabama, and Alpha Alpha Upsilon Omega, chapter of Alpha Kappa Alpha Sorority Incorporated of Wellington, Florida. We would like to extend a special thank you to our production team, C. Ron Allen and Nelonsky Noel of KOP Mentoring Group. That's it, and enjoy the show. Good afternoon, everyone, and welcome to another show of My Health Matters. My name is Kitty London, and I'm your host. We are going to have a very exciting show today. We're going to discuss prostate cancer, bladder cancer, and its treatments. Our show is brought to you by Global Health and Community Service Incorporated and also Florida statewide organization of Omega Psi Phi Fraternity. Before we start the show, we want to give out greetings. Our first greetings is brought to you by Dr. Lewis Hines. He's the chairman of the Florida statewide organization of Omega Psi Phi Fraternity, Inc. Welcome, Dr. Hines.
Lewis Hines, and I am the chairman of the Medical and Health Committee of the Florida statewide organization of the Omega Psi Phi Fraternity Incorporated. We are happy to be hosting our fifth health forum for 2022. For those of you who are joining us again, thank you for your continual support. If this is your first attendance at our health forum, thank you for attending, and we hope that you join us again for our next four remaining health forum for 2022. We are excited to present these health forums to provide you with signs, symptoms, and treatment options for various medical conditions. It is important to be healthy, and we hope to do our part in providing invaluable information for you and your family. I extend a special thanks to our panel of experts and special guests. On behalf of Brother Darren Tolston, the state representative for the Florida statewide organization and the Medical and Health Committee, I extend to you our heartfelt greetings. And again, my name is Dr. Lewis Hines, and thank you for joining us.
Thank you, Dr. Hines. Our next greetings will be brought to you by Cordell Hayes, the interim executive director of Global Health and Community Services, Inc. Welcome, Mr. Hayes.
Thank you. Good afternoon, everyone. My name is Cordell Hayes, Interim Executive Director for Global Health and Community Service, Inc. Today, we have brought some experts to talk about a very sensitive topic, prostate health. Thank you to all the doctors that are here today. We're hoping everyone leave here aware of signs, risk factors, and treatment options. We also have a great friend, Willie Carpenter. He is an actual prostate cancer survivor. We extend a special thank you to him for joining us and sharing his personal story. Thank you again for joining us so that we can better help our family, friends, and even ourselves. On behalf of Global Health and Community Service, Inc., thank you. Greetings.
Thank you very much, Mr. Hayes. Now we are going to have our welcome by the beautiful Anicia Morgan. She is Miss Globe Jamaica 2022. Let's welcome Miss Anicia Morgan.
Oh, good afternoon. Can everyone hear me? Oh, I think there's something with the.
They're not hearing you still.
I don't know. I'm not hearing any.
But they're
oh,
hearing you.
oh,
Yeah,
wow.
go ahead.
Okay. Let me start over from scratch. So, good afternoon again, everyone. My name is Anicia Morgan, Miss Globe Jamaica 2022. And when it comes to prostate cancer, the American Cancer Society estimates that in this year alone, that the this year alone, that within the United States, about 268,000 new cases of prostate cancer will be diagnosed, and about 35,000 men will succumb to this form of cancer. Today, we have top experts who will explain the signs, symptoms, and treatment options for prostate cancer. We will also hear the riveting story of Mr. Willie Carpenter, and Mr. Carpenter will tell us about the very moment when he received the news of his prostate cancer diagnosis, and that promises to be riveting, of course. So sorry. I'm a little nervous, guys. Needless to say, it's really important that we understand our bodies and that we understand our health. By the time we leave here today, we honestly hope that you will be more knowledgeable, more empowered, and definitely more comfortable. I'm getting there. As you talk to your friends and families and other loved ones about prostate cancer, remember, doctors don't read minds. So always feel free to ask questions because they always gonna, because they're always happy to answer. Yes. I am Anissa Morgan, and welcome. So sorry, guys. Welcome.
Thank you very much, Anicia, for that warm welcome. So we're going to welcome our panelists today, and I'm going to read out their bios really quickly. First, we have Dr. Tracy Downs. Dr. Tracy Downs is a professor of urology and our inaugural Chief Diversity and Community Engagement Officer here at UVA Health and Senior Associate Dean of Diversity and Inclusion within the School of Medicine. He is also a board-certified urologist specializing in the surgical treatment of urological cancers and subspecialty focus in treatment of both prostate and bladder cancer. Next, we have Dr. Christopher Tallman. Dr. Christopher Tallman is a board-eligible urologist who practices general urology with a particular interest in minimal invasive surgical management of benign and malignant prostate disease, as well as minimally invasive kidney surgery. Our next guest is Mr. William L. Carpenter. Mr. William L. Carpenter is a senior vice president, a market manager at South State Bank. He has over many years maintaining a position of leadership in the finance and banking industry. Mr. Carpenter earned a bachelor's of science degree from Western California University. He is very active in the community in Miami, Florida, and serves as the Orange Bowl Committee. But more importantly, Mr. Willie Carpenter is a prostate cancer survivor. Thank you. Now it's time for a commercial break.
Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Hello, everyone. This is Kitty London, and I'm your host for My Health Matters TV, brought to you by Global Health and Community Services and the Florida statewide organization of Omega Psi Phi Fraternity Incorporated. We have an exciting lineup of shows with a variety of topics that will make you say, have you more educated on your health, and hopefully convince you to make your next checkup. October, sickle cell disease and the sickle cell trait. I have it, so I want to make sure that you are more aware on the community and what's going on with sickle cell. In November, when we eat so much, we're going to talk about nutrition again, but also talk about diabetes and the treatment. In December, make sure all my couples check in, because when you think the thrill is gone, it does not necessarily mean that. We are going to discuss ED, which is erectile dysfunction. Now, you want to know how can you join us? Well, I am glad you asked. I want you make sure you check in on Global Health Foundation on Facebook, and that's Global Health Foundation on Facebook, and also KOP Mentoring Network on YouTube. So we cannot wait to see you, and hopefully we can all learn together so we're more educated on health. See you then. All right, it's time to start the show. Let's bring on the panelists. All right, I want to welcome Dr. Downs, Dr. Tallman, and Mr. Carpenter. Welcome to the show.
Thank you. Good afternoon.
I'm so excited. So let's start off with the basics. I'm going to start off with you, Dr. Tallman. I didn't really pay much attention in anatomy, so I need to find out, first of all, where is the prostate located?
So the prostate is an organ that's located in men between the bladder and the penis, the base of the penis. And so it's the way we access it for checking for prostate cancer is through the rectum. So it's a small organ typically that sits right between the bladder and the base of the penis.
Okay, so our topic today mainly is going to focus on prostate cancer. So prostate cancer is the cancer, of course, that is in the prostate area. Can you just give our audience just a little information on what symptoms they can have if they have prostate cancer? When should we start checking, as far as the men start checking around that area to see if they're, candidates for prostate cancer? Can you give us that information, please?
Sure. So prostate cancer is typically a slow-growing cancer that is very common in men. We always talk about the fact that most men die with prostate cancer, but not die of prostate cancer. So certainly a lot of that has to do with the detection of prostate cancer in men who are at risk. And so screening typically begins at age 50 for most men. However, if you have a family history or strong familial link, there's times that we do check sooner than that, sometimes 10 years prior to that. But there's a number of ways that we'll talk about the screening for prostate cancer.
Okay. I like when you mentioned about the family history, because unfortunately, some people don't know their family history, unfortunately. Do you know of any symptoms for people who, let's say, their father or uncle, no one had it, but they're feeling some type of way? Are there symptoms that people need to look out for?
Sure. Most of the symptoms of the prostate are actually not related to cancer. It's actually quite uncommon to have any symptoms related to prostate cancer. So this is why routine screening is very important. It's very important to talk to your general practitioner. I find a lot of patients come to me as a urologist for after evaluation by their primary doctor, or they're just unsure. Some primary doctors aren't necessarily comfortable doing that in these days and age, but there are very few symptoms with it. However, the prostate tends to grow with age, and it can cause urinary symptoms. That's one of my focuses, is the benign or the non-malignant component of prostate enlargement that can cause urinary symptoms. So that also factors a lot in my treatment options and taking care of patients. But most of the symptoms are not related to prostate cancer. However, you can have back pain and advanced prostate cancer. It can go outside of the prostate and cause bone pain and things like that. But certainly that's not the common first presentation that we see.
Okay. And can you tell us also what is prostatitis? I know that's a tongue twister for me, but can you tell us what that is, please?
So prostatitis is just an inflammatory condition of the prostate. It's usually related to some degree of bacteria in the prostate. It's very common. Typically, you can have a short course of it where the prostate's inflamed and it causes a lot of urinary symptoms, difficulty urinating because of the inflammation and enlargement of the prostate as it closes around the urethra. I always describe the prostate like a donut with a hole in the middle, and that hole is what you pee through, is the channel. And as the prostate enlarges or becomes inflamed, that channel kind of closes off, the donut hole kind of fills in there. So enlargement can cause that, and that can cause urinary symptoms, some pelvic and perineal pain and discomfort related to that, sometimes associated with infections. But it's usually a kind of transient condition we usually treat with antibiotics.
Okay. And I'm sure you probably get asked this question, especially by a lot of patients. What are the main causes besides hereditary disease, being a hereditary disease? What are the main causes of prostate? Is it injury? Is it too much sex? Is it what can cause prostate cancer?
Well, too much sex never causes prostate cancer. It causes
all the men are going like, woo!
Yeah. So don't let anybody tell you otherwise on that. The cause of prostate cancer is basically at the cellular level of the prostate, and it has to do with the growth and the transformation of cells. There's certainly plenty of evidence to suggest that dietary factors can help limit the risk of prostate cancer. Some foods you can eat, but there's not compelling evidence to say one way or another to push that. But it has to do with the overgrowth of cells and the transformation from normal prostate cancer cells, or prostate cells, which are glandular secreting cells. And then they have these basically microscopic changes that happen and grow. And it has to do just with the proliferation and growth over time. But it's not, like I mentioned before, enlarged prostate. It has nothing to do with that process. It's typically a different aspect of the prostate, different area. And cellular process there.
Okay, thank you. Okay, Dr. Towns, on to you next. In regards to bladder cancer, can you tell us the relationship, or is there any relationship between that and prostate cancer?
Sure, Kitty. Thanks for that question. So typically the answer is no. So they're next door neighbors, and that the bladder lives above the prostate, but those cancers are typically unrelated. Now, the one thing that can happen is that sometimes in men who've been treated with radiation therapy for their prostate cancer, usually maybe 10 years or a decade down the road, they can be at risk for bladder cancer. But that's the only linkage.
Okay. And I'm going to ask you the same question as far as bladder cancer. I know women who are probably looking at this show are going to say yes. We typically will go sometimes behind you all, right? I'm like, can you put down a seat? But then we'll also notice when you left something, and it's like, okay, the urine, you need to drink water, honey. Can you tell us how people get bladder cancer, or the signs that, someone may be going to that direction of getting bladder cancer?
Yeah, most definitely. And this is a nice kind of contrast between prostate, where Dr. Tallman told you that prostate cancer, that there aren't signs. Usually you feel great. And so with bladder cancer, we actually know what one of the most common causes of it is, and it happens to be smoking. So in individuals who smoke, and it's more cigarettes than cigars, or that is the biggest risk factor. And so for many, many years, probably early 1990s, we've known that there's a product that's secreted in the urine that is linked to the byproduct in tobacco, and that puts someone at risk. So you can lower your risk significantly by stopping smoking, but oftentimes you may have urinary frequency, meaning you're going to the bathroom a lot. And then the really scary one is if you go to the bathroom and you actually see blood in your urine. That is truly something that should get your attention, call your primary care, and then hopefully get a quick referral to see Dr. Talman or myself in urology. And that is something we call gross hematuria. So we call it gross, I guess, because not because it's gross, but because you can actually see it. And then there are other times that your doctors may see blood under the microscope that we call microscopic hematuria. And both of those are trigger points to get you referred to a urologist.
Great. And I don't want to leave my women out, because we also get bladder cancer as well. I know a lot of women who suffer from urinary tract infections. Do they lead to bladder cancer, or are you higher at risk? And this is for like the women who are listening, so we can get ourselves checked out too.
Yeah, and Kitty, thank you so much, because this is really an important point for our female listeners, is that now, while bladder cancer is more common in men, and it typically, again, is that smoking connection, women are catching up in terms of their smoking. And so they are kind of starting to become more familiar. What happens to women a lot is, because they do get urinary tract infections more commonly than men, is they may be seeing their primary care or their gynecologist, and they keep getting treated over and over again for a presumed urinary tract infection that they can never kind of get over for any sustained period of time. Those are moments where they actually may have a bladder cancer. And so there's data to show that women get diagnosed later and then get referred later, and some of their survival and successful outcomes may be lower, because they're kind of in this urinary infection kind of trap. And so if they're getting a UTI over and over, then what they should do is just say, hey, can you maybe just send me to a urologist and see what he or she thinks? It could be in their best interest.
Great. Thank you. So women, listen to Dr. Downs. Get that checked out. Dr. Talman, I have a question for you as well, too, because I know when you diagnose, unfortunately, your patients that have prostate cancer, can you tell us some of the biggest maybe stigmas that are around, or rumors that really scare men, one, from getting tested, and then two, once they find out that they have it?
Sure, great question. So there certainly is, I as a man, obviously think about all my patients that come in that are concerned about getting checked for prostate cancer. So I'd like to just highlight a couple of really important things as far as checking for prostate cancer. So the screening for prostate cancer, meaning blood test and a rectal exam to feel the prostate with the finger, the old finger test is what most patients call it, has a lot of bad stigma. The blood test has a bad stigma because of data a number of years ago that was suggesting that over-testing for the PSA is what that is, a prostate-specific antigen, which is a blood test to help guide the risk of prostate cancer. It can be elevated for a number of reasons. Usually the number 4 with a PSA of 4 is when most people would recommend a biopsy. There's a lot of caveats to that, but about 85% of men with prostate cancer have a PSA of over 4. Okay, so 15% of men with prostate cancer can have a PSA less than 4. So the PSA is usually the first screening point there, and usually prompts referral over to us. But the prostate-specific antigen, that PSA lab, can be high because of an enlarged prostate, prostatitis that you referred to earlier, or prostate cancer. There's a number of causes. So I don't react at a number alone. I react based on number, the history, a conversation, and then importantly also the rectal exam, which is the finger test of the prostate. I have to emphasize, I do this all day, every day. So as patients are really hesitant to say, I really don't want that at all. Most primary doctors nowadays are not doing that because a lot of cancers are missed from it. But I can tell you, just last week, I diagnosed a patient with prostate cancer, and he said, no, I don't want you to do that. And I said, sir, Mr. Smith, you really need to have this because this is part of our bread and butter urology. This is how we diagnose prostate cancer. It's a very important tool. And checking it, and certainly had an abnormal exam. I went on to do a biopsy later on. But men should not be fearful of having that. That's really not the most pleasant thing to do. But the good news is you have it once, maybe every 6 months or 12 months. I have to do it all day, every day. So your one time is you, and I do it about 40 to 50 times a day. So good for you, bad for me. But that's the choice I made. So. But it's really not a terrible thing.
Well, I'm glad you made that choice because you're saving lives. And we're definitely going to get to you, Mr. Carpenter, soon. You are our survivor, and I really want our audience to hear your story. Dr. Talman, really quick, too. Once you diagnose and your patient realizes when they have that talk, okay, I have cancer. So now what? Can you just give us briefly treatment options, one, and is surgery always like off the table, or we have to have surgery, we have to get it out? Or are there other treatment options?
Certainly, great question. And there's a lot of new treatment options that are coming out. I'll give you the overview real quick. It depends on the what the pathology shows after doing a biopsy. And the pathology is the tissue diagnosis, where the pathologist looks at it under the microscope and says, okay, you have prostate cancer and you have this type of prostate cancer. Typically, we describe it as Gleason score, which is named after the pathologist that came up with the system, Don Gleason. And it's 6 to 10. So don't get confused with PSA. PSA is the number for the blood test. But the Gleason score is the architectural structure of the prostate cancer. So 6 to 10. And not to get in the details too much of it, 6 is less aggressive and 10 is more aggressive and very high risk. And so the treatment for each patient is patient-centric and patient-specific. It's also based on the pathology. The PSA score factors into that as well as the patient's age and comorbidities and how healthy they are. So surgery is one of the most common treatments. Certainly, I'm a robotic surgeon, so I do a lot of robotic prostate surgery, minimally invasively. Radiation is an option. There are other treatment options for more focal therapy to target just the prostate cancer, either heating it or cooling it. There's different newer types of technologies to treat like that. And some men, interestingly, are candidates for something called active surveillance, which is after a man has the diagnosis of prostate cancer, if it's a very early type that we know with the literature and over 10 years of strong data to support, we can watch this. I have patients that are on my active surveillance protocol that I monitor them closely with PSA checks and even repeat biopsies in 12 to 18 months, where we follow this and to try to limit the side effects of treatment and in men that don't need treatment. So there's a whole spectrum, including even just watching it, which is a hard thing for people to kind of wrap their heads around. But I think it's really important to focus on your specific prostate cancer, the disease state, your overall health, and your functional outcomes and what you're looking for.
Okay, I have two questions now because you just made my head spin. when you said robot, I know people are like, wait a minute, a robot's going to work on me? Wait a minute. I want a human to work on me. Are there any disadvantages or advantages by having a robot work on you versus a physical doctor like yourself go in there? Can you
there are certainly advantages and disadvantages, but let me make very clear, the robot's not doing the work. I control the robot, or Dr. Downs controls the robot. The urologist is controlling the robot. It doesn't have a mind of its own. And certainly what it basically does is holds the instruments, allows us to work in three-dimensional space with high definition cameras through small incisions, small holes. So it allows us to, instead of the traditional surgery, which is a large incision to open up the abdomen, get down to the axis of the prostate and take it out that way. It allows us to have a quicker recovery. My patients go home the next day typically, very low risk of bleeding because of the advantages of using a minimally invasive approach, quicker outcomes. The surgical outcomes, when you compare between the traditional open surgery and not, are really demonstrated in blood loss. You can do a higher fidelity surgery, but I've trained with some people that my mentors that had done, over 1,000 open surgeries and over 1,000 robotic surgeries, and there's only a few in the field still that have that experience. And your surgeon experience is the key thing to that. You don't want somebody that just says, I have this fancy robot in my hospital, I don't do the surgery. The skills, the training, the experience, and the doing something over and over is the most important thing, because each patient is very specific and unique, and you need to be able to account for all those things.
Great. And I have one more question for Mr. Downs, and we're going to get to you, Mr. Carpenter. So as you mentioned, especially women, one shout out for my women, we're usually really good about going to the doctor, right? We have our list of doctors that we go to yearly, gynecologists. We have our primary physicians, eyes. We're good usually, right? So I know sometimes our men need help, but when you think about a urologist, that is a specialist. Should men, once they start going to the doctor, normally put a urologist on their list and say, well, I'm going to be proactive and I'm going to go to urologist yearly as well? Like my wife goes, or my whatever goes to the gynecologist. Should that be on the list to see before things happen?
Yeah, that's an easy question for the urologist, right? We'd always say, yes, you should add us to your daily, yearly visit. But no, you raise a really good point, and we would put it under the umbrella of like men's health. So we know that women's health, women's initiatives have really empowered women to advocate for themselves and also change the dynamics of healthcare and what us, support kind of quote unquote experts would recommend, and how that back and forth dialogue. So men really need to do the same thing. And what we saw when Dr. Talman was talking about the grading system of how we were graded on PSA screening, this was done by a task force in the US. And unfortunately, in that grading, they actually, we didn't have enough data on African American or Black men. And so they kind of said the benefit of screening for Black men is not good like it wasn't for white men. And we knew that wasn't the case. We just didn't have the data to say so. But over and over and over again, what many urologists, primary care, African-American men would say to me and others is that, sometimes that getting me in there to get the blood test is one first step in a conversation that opens up other conversations about my health. Now you check my blood pressure, maybe that's a little high. And then now we talk about, well, what's about your colon cancer screening? Are you doing that? So it is just a nice entree into, I think, being able to advocate for yourself and your health better. So long way to say, guys, we got to step it up and get on board with the women and do the right thing.
Thank you. So we have one more question. Oh, go ahead. I'm sorry.
I was just saying, very well put, Dr. Downs, very well put.
Right. We have one question that we'll be able to take from the audience, and then we'll have a commercial break, and then it's Mr. Carpenter's time to talk about his experience. But really quick, Dr. Talman, is there any connection between prostate cancer and erectile dysfunction?
Yes and no. And Mr. Carpenter will probably talk a little bit more about this in his story that he shares later on. No, prostate cancer is not related to, if a man has erectile dysfunction, there is no functional relationship to prostate cancer. I say yes because the treatment options for prostate cancer can have an effect on the erectile dysfunction or a man's ability to have a firm erection for sexual intercourse. But the erectile dysfunction itself is typically related to a neurovascular issue. There's very small blood vessels that go to the penis and kind of bathe the nerve tissue for erections. Those are vascular and separate from prostate cancer itself.
All right, thank you. And one more question. Does consuming alcohol or caffeine contribute to enlarged prostate?
For enlarged prostate, no, it does not. Alcohol and caffeine typically are diuretics, which is a class of activity on the kidney that allows makes the kidneys make more urine. So as you take more caffeine or alcohol in, typically you'll urinate more often. It doesn't cause an increase in the size of it. But actually there's interesting data to support that caffeine, specifically coffee, may have a protective benefit on the prostate and help limit some degree of prostate cancer formation. It works out well because I drink a lot of coffee to kind of make it through the day and keep focused. But yeah, there's no direct correlation with alcohol and caffeine causing enlarged prostate or prostate cancer.
You made a lot of people happy right now. I just want to let you know that. You made a lot of people happy. All right, so we have to pay some bills, and then we're coming back, and we're going to talk to Mr. Carpenter about his story. Thank you.
Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Hey, this is Kitty London, your host for My Health Matters. My health matters, but so does yours. I just want to make sure that you are aware that we have an amazing lineup still coming your way before the end of the year. And these shows are brought to you by the Global Health and Community Service Incorporated and also the Quantum Foundation. Starting October 1st, right here at noon, we will discuss the sickle cell disease and treatment. Sickle cell disease and trait are near and dear to my heart because I have the trait, and I want to make sure that you are aware that there is treatments out there and people are living long with this disease. Also in November, when the holidays start and we want to eat everything in sight, well, at least I do, we're going to talk about diabetes, nutrition, and also the treatment. And that is going to be on November 5th, right here at noon. We want to make sure those numbers stay right so we can be around for a long, long time. Then in December, I want to make sure all my couples check in because we're going to talk about something that a lot of people may not want to talk about, and that's ED, and that stands for erectile dysfunction. And that happens on December 3rd. So when you think the thrill is gone, it may not necessarily mean that. We're going to have physicians that are going to talk us through this. So if you want to see all of these shows and any shows that we've done in the past, please make sure you check out KOP Mentoring Network on Facebook and also KOP Mentoring Network on YouTube. We cannot wait to see you because remember, my health matters, but so does yours. See you soon. Bye. All right, we are back. We are back. To the audience members who had questions for Mr. Carpenter, I did not ignore you, but I know that we would get to all the questions once this story started. So we want to welcome back Mr. Carpenter. If you can please place him on the screen so we can get back to the show. Welcome, Mr. Carpenter. Thank you.
Thank you, Kitty, for having me.
You're welcome. Listen, I didn't want to take too much for your story away, so this is why I saved you. You know, they say save the best for last. Doctors, I love you, but we got to talk about the survival. So, Mr. Carpenter, one of the main questions, and you know, I had it as well too. Let's talk about how you learned you had prostate cancer, but more importantly, what made you find out? Were there any symptoms that you had to make you discover this disease?
Well, I never had any symptoms, but being a former athlete, we get physicals every year. I've been getting the physical since junior high school, and when I started working at the bank, it was required to get a physical as an officer. And I had a very good general practitioner that each year I would take a PSA test. And as the years went on, it started elevating, and it got higher and higher. And finally, she recommended I go see a urologist to get checked out. So there wasn't any signs of getting up urine at night or can't urine. It's just that it was just being proactive and getting tested every year.
Okay. So would it be fair to say that you caught it at a really early stage?
I caught it at a very early stage. Very.
And I think that's very key, especially for our listeners. So it was based on the blood work, and it got higher and higher. And some said, "Hey, we need to get this checked out." Can you just like relive that day really quick for us when you got the test results back? How did they give you the information? I mean, it's hard.
It was a series of tests, and the doctors talked about that early. My general practitioner was uncomfortable with the PSA numbers going up, so I went to see the urologist. And you know, we always have this stigma about the doctor test. You know, put this finger in your rectum and getting tested. Well, I never had that fear, that complex, because as the doctors explained to me, that your health means more than any kind of fear or macho feelings. So I got the doctor did the rectum test, and he felt like there was something that was sort of enlarged, but that wasn't what he wasn't sure about that. So he says that the true method of testing would be having a biopsy test. Mm-hmm. And so the next step was having the biopsy, which is invasive too. They go up your rectum and and they cut 4 or 5 slices of tissue. And as the doctors talked about that, the pathology comes back. So once it takes about 2 or 3 weeks to get the test back, and then the doctor calls you in the office. And I do remember getting the results back, and the doctor said, we have the results back, and he says you have cancer. So, and at that time, that's the only thing I could hear, and it was just a blank stare. And the doctor was putting his hands over my face, saying, you know, are you there? And I wasn't there, because the minute that the doctor says cancer, you think you're going to die. Mm-hmm. So when I got past that, and the urologist literally said, "You're not going to die." Wow. Okay. And that snapped me out of it. And he says, and he started walking me through the different steps that we have to take from there. But the initial reaction is that you're just in a fog. You don't hear anything. You don't see anything. You just think about the sea, and that you're going to die. And that was my first reaction. And he walked me through all the other steps that what I need.
Now, from the diagnosis from that day to actually surgery, can you just give us like really brief your support system? You know, how did you digest this? What things you had to go through to get prepared for surgery, and why did you elect to have surgery?
Well, and the Dr. Tillman and Dr. Downs talked about the treatments, and the urologist says you have 2 choices. You can continue living the life that you're living, and he said your business, you know. And I'll go back and I talked to you about this early on, that that it affects your business, and everybody knows what your business is, that before prostate, you're fine. And the doctor says you can continue your life of what you're doing now, but at some period of time, your quality of life is going to deteriorate, and you won't have any business, and you're probably going to die. Or there's surgery, and there was a couple types of surgeries and he said that you could have the surgery. Yes, your business will not work as well as it was, but your quality of life will be good. So I chose to have my quality of life, and I chose the surgery. And and Dr. Tillman talked about the surgeries with the radiation and the Da Vinci robotic surgery. And I chose to have the Da Vinci robotic surgery with less invasive. And it went in, and I was out, as he said, out the next day.
Wow. Out the next day. As simple as that sounds.
It's not simple.
Right. Well,
it's,
you run in the hospital for, I mean, I would consider a major surgery. So,
it is a major surgery because they don't cut you open, but
right.
But you're out the next day. And with the surgery, if you're healthy going into surgery, you're going to be healthy coming out. If you got poor health going into surgery, you're going to have poor health coming out of surgery. And I was healthy going in, so the recovery was a lot quicker, but the recovery was a challenge.
That's what I was going to ask you about, the actual recovery, because when you say I'm out the next day, it sounds like, I can get out and tap dance. The next day, I can get back to normal. Okay.
You can't go out and tap dance.
Okay.
You come out and you actually have a catheter, which is shocking to walk around for about a week at home, and you got to change it. You have a large one when you sleep, and you have a small one that's attached to your leg, but you'll get past that.
Assist you with urinate. Let's just for the audience to say, well, what was the catheter for? This is to assist you with urination.
Yes, as the doctors were saying about once your prostate is gone, to fix your bladder. So your bladder is just constantly running, and it's almost like it's uncontrollable. So you have the catheter and the bag on for about a week, and then you go back and you get it taken off. And I remember, I heard these horror stories about having a catheter on and when they have to take it off, it's like pain from hell to take it off. So when I went to have it removed, and I was talking to the nurse, and I'm ready for this pain to happen, and some kind of way she took it off, and I'm still talking to her, and she says, "Okay, you're done."
Wow.
It was gone. I mean, it was taken out that quickly.
Mr. Cartman, if you could just pause for a moment right there, because you said something very vital when it comes to just people's health. We hear so many rumors about things that happen to other people that sometimes it causes us not to either go to the doctor or get a certain procedure because we heard all these rumors, right? These folk tales. And then we don't do the things that we should do because we heard all these things. And you just said you heard it hurt so bad and you didn't feel anything.
No.
Everyone has a different experience.
Everyone has a different experience. And I heard these stories about having it on and how painful it is. And within a matter of seconds, it was taken out and with no pain. Maybe my experience is different than someone. It could have been the caretaker that was taking it out. Yes.
Or maybe they just started something. But, not to get up all in your business, because I know you're talking about your business, but the road to recovery, when the soldier stands back up and is ready for war, how is that process? What is the rehab like to kind of get you back to where you were?
Well, I don't think you'll ever get back to where you were. And also because of this December will be 11 years, and I'm 65 now. So age has a factor too as time goes on. So, you'll be able to salute won't be able to hold your salute up as long as you did in the past, but the salute is still there. But if I could tell you about the recovery,
yes.
The recovery can be very trying. And you asked early on about having a focus group of someone that you can talk to after surgery. And I was fortunate enough that I knew some gentlemen that had gone through this type of surgery, and they were able to, when I had my down times and things was not going well, that they were always there to lift your spirits up, because when you have to go, when your bladders continue to running, and the doctor says, well, you're going to have depends, and we all know what depends are. And so, I tell the story that I went to CVS, and I bought every depend that they had. I think I had 2 shopping carts full, because I was never going back into CVS again to pick those up, because I didn't want anybody to think. I said, well, no, they were looking at me, and I was saying those are for my grandparents. That's not for me. But that's a stigma that you have to get past, because you have to wear those for a certain period of time till you get your bladder built back up. So that was a trauma. But I got past that. And then lastly, to be able to get your bladder, they run it's like an electrical tube in your rectum to wake up your bladder, and you go through several treatments of that. And once you go through that and wake up your bladder and strengthen your bladder, you will never be normal again. I mean, the intake of fluids that you've had in the past, you will not be able to do that. So there's downsides, but the positive side is that your health is good. You got a long time to live. The downside is that you don't do anything, your quality of life is going to go down, and eventually you won't be with us.
Right. And I was going to say, you look really good.
Thank you.
Before we bring the other doctors back, because I know we have a couple of questions from the audience that we'll try to get to before the end of the show. Just one piece of advice, Mr. Carpenter, if you can just tell a young man, old man, whatever man that's listening to the show or listen to the future, if they have any fear about this and they're just like, I don't know, I can't. What advice would you give them?
I think the number one fear is your business. So how's it going to affect that? But your number one goal is that you want to be healthy and live a productive life. And you have 2 choices. You can not do anything and think that you have a productive life, and as time goes on, your health is going to deteriorate, and you won't have to worry about that aspect of your life or your business. Or you can go in and get checked regularly to make sure that those things don't happen.
Very good advice. Thank you so much for being so transparent. We
Thank you.
need this in our community.
Yes. Thank you for having me.
Oh, you're so welcome. So you can stay on the screen, I assume. We can bring the doctors back. We have a couple more questions. Welcome back, docs.
Thank you.
Thanks.
Let me just get this one question here. I'm getting questions from everywhere. I just want to let people know. I'm getting questions on the chat, the text. Everybody has a question about today's topic. Okay. So the other question, and this can be for any doctor, it doesn't matter who wants to answer this. Any effects of surgery and alternatives to lack of erection? Anyone want to answer that one?
So the effects of the erection and surgery is, there is a little bit of a misnomer saying that it won't happen with radiation, which is technically not surgery, which is delivering radiation directly to the prostate to kill the prostate tissue. The nerves important for erections surround the prostate and come around as they go to the penis. So anything we do treatment-wise for the prostate has a risk for erectile dysfunction, whether taking out or not. The important thing of, like Mr. Carpenter was saying, he was caught at an early age. What I always tell my patients for surgery, you're never going to be better than the day you were before surgery, because, when you work on the prostate, and somewhat similar, I'm sure Dr. Downs' experience with bladder cancer and treating that is there's always a risk of that dealing with bladder cancer. Surgery is, things aren't going to get better. It's not going to magically have prostate cancer treated and things are even better than before. But there are a lot of different treatment options, whether it's after surgery or radiation, including medications and pills. I know every guy watching this is going to shake their head and say, this guy's crazy. But there's injections to the penis that deliver medication for erections directly in there. I've taught hundreds of men how to do it after prostate surgery and their recovery. And they all shook their head and said, "No way, I'm not doing that, doc." And then all of a sudden, about 50 to 70% of my patients will try that and use it early on as they recover. And there's certainly other options as well, as including penile prosthesis or inflatable devices that go in the erection chambers of the penis that you can pump up and do that. But that's always a conversation of things to know about before treating prostate cancer, is that we have great treatment options that have been well studied, well developed. There's newer technologies, including stem cell therapy, that's on the horizon that I'm working on. There's other treatment options as well, which is always a good segue to December's talk on erectile dysfunction. But Dr. Downs?
Dr. Tillman, can your PSA can have a false positive negative? Say the night before you have sex, the night before you have your PSA test, that can have a false negative on your testing too. And I don't know if a lot of men know that too.
Yes, absolutely. So I usually don't counsel my patients on abstaining from sexual intercourse. I've actually found that it's way more important we get the PSA, and then we don't necessarily jump on it based on if it's high, then we start talking about repeating. But it is true, if you ejaculate the day, or actually within 24 to 48 hours before you check your PSA, or if you're an avid bicycle rider and have a lot of that kind of hitting of the perineum on a hard seat, things like that can cause the PSA to be elevated. And also, as I mentioned, prostatitis causes it, enlarged prostate. So I think it's important I don't limit kind of how I do all the PSA testing, but I think about that as far as repeating it and things like that if there's hesitation. But I think the most important thing in my practice is getting the PSA testing, getting a rectal exam, and then having a conversation versus just closing the door and saying that's it.
Great. Now we have room for, I think, just 2 more questions. So doctors, if you can answer these questions as quickly as you possibly can. Dr. Downs, I'm going to shoot this question to you. This is by Pat J. Dixon. Incontinence, is that expected result of surgery or treatment? Is that like something that people always get, or to expect to have incontinence afterwards?
Yeah, I think Mr. Carpenter really kind of hit the nail on the head and given you a good understanding of things. So if you get treatment from radiation, then it's not incontinence, but it's frequency. So going very often, and that gets better over time. But during the course of when you're being treated for radiation, and your physician may give you a medicine called an alpha blocker, something called Flomax or tamsulosin, to lower the risk of that being a problem. After surgery, I would say almost now it's kind of like you're learning something different, and you're learning to use these new muscles. So I think at first every man is going to struggle with that. And I give the example, we have these thing called sphincters. Think about an outer door and an inner door, and think about your outer door as being automatic. It opens, closes, you don't have to do anything. That's the one that keeps you dry. And so that's the door or sphincter that gets removed with surgery. And now you're relying on the inner door that you've got to like put the key in, turn it to lock it, turn it to open it. And those are the muscles that Mr. Carpenter's talking about that you have to train. So you're going to have to get used to those muscles again. And you can actually practice a little bit before surgery, so you're a couple steps ahead. But Dr. Talman and others with the robotic surgery are so good now that the likelihood of like severe incontinence where you would really have to do pads, like lots of pads every day, is very, very minimal that's going to happen.
Okay, thank you so much. And the $1 million question that I think most of people want to know before we close is, does prostate cancer affect your sex life? So I don't know who wants to take that, but we only have a few seconds.
I think it can.
Okay.
And I think it all depends on your age, because as time goes on, it affects with age. So, and as the doctor says, it's never going to be the same going in and coming out. And you have to be comfortable with that and have that mindset that it's never going to be the same.
Great. Dr. Talman, I don't want to cut you off, but this is a real important question because I have sons too, and I want to talk fast so I can get it out. We have a viewer who has a son who's 25. Can people start getting checked that early? Is it good to, like, is there an age to start getting checked really early for prostate issues?
There is typically an age. Typically, if you have prostate cancer, we typically recommend 10 years before the age of diagnosis of let's say the father or the paternal uncle. I would not recommend checking somebody at age 25. You certainly check the PSA, and maybe Dr. Downs feels differently about that. That's too early, and I've never seen a prostate cancer that early. The youngest I have seen is a 39-year-old who had prostate cancer, but he had all the risk factors. He had a father that was diagnosed in his early 40s, had advanced prostate cancer, and so there was a lot of red flags for looking at that. But typically, we look at 10 years prior to the age of diagnosis of a father or uncle. But I don't know if you agree with that, Dr. Downs.
I sure do. And Kitty, if I could just sneak one in, just to say thank you to Global Health and Community Service and that you care. And I want to just highlight Mr. Carpenter and Dr. Talman, and that having people in your corner who will advocate with you and listen and learning from their experiences. So if you don't have a Mr. Carpenter in your life, get one. And then the honesty and the investment in his patients that you see Dr. Talman makes, it makes a difference. So if you're getting the sense when you're in the doctor's office, like, they're not telling you the pros and cons, and they're just kind of like everything's shiny and looks spectacular, and they're not giving you the honest truth, just trust your Spider-Man or Spider-Woman senses, in this case, Spider-Man senses, that maybe you need to go find another urologist. Because I think you got some great advice from a patient expert and from a surgeon who lives in the trenches and who wants his patients and gives them great, honest, open feedback. That's what I heard today.
All right. Thank you all so very much. I know it's ending. I wish we had another 30 minutes, but unfortunately we don't. The numbers are scrolling on the bottom of the screen of how to reach the doctors. I don't know, Mr. Carpenter, if you have a social media page or how to reach you, if they want to be in contact with you.
I'll send you guys my email address.
Okay, great. So it does not end here. It ends today for our show today, but October 1st at noon, please come back. We will discuss the sickle cell trait and disease, and this is affecting a lot of people right now. And if you know anyone who is suffering, from depression, please, we have the 988 information. 988 is the National Suicide and Crisis Lifeline that offers 24/7 free and confidential access to trained crisis counselors who can help people experience mental health related distress, including suicidal, mental health, and substance use crisis. Remember, the number is 988. Thank you, everyone, for joining us, and we will see you again soon. This has been another edition of My Health Matters.
You